Welcome to the First Nations Health Managers Association's weekly town hall with your host, Marion Crow, your resource for COVID-19 related news and information. Send us your questions to FNHMA@ihtoday.ca. Over the next hour, you'll hear from health professionals and Indigenous community leaders. As always, we have reliable and credible information for you and your community. We want to hear from you.
Tansei, I would like to recognize that this is being broadcast from the NationTalk studio in Toronto, home of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and many other diverse nations. Thank you for getting your information from the First Nations Health Managers Association. This will be a tough episode today. I hope that you saw the acknowledgement that this may trigger some individuals. It is a welcome discussion that we are having all across Turtle Island. And I would like everyone to join me from your nation's territories and organizations in a pause, a moment of silence for the lost souls who are being sent home now. Thank you. I really I realize that was dead air for a couple of seconds, but it is the least we can do as we wear orange in recognition of all survivors waiting for loved ones to come home. And as we continue to have these dialogues, we know that children will be whispering, "They found us. We're finally going home." My name is Marion Crow. I have the humbling privilege of serving as the Chief Executive Officer of the First Nations Health Managers Association. I am proudly a Treaty 4 territory person from Pie Pot First Nation in Saskatchewan. It is an honor to serve, not only in normal times, but especially during this global pandemic. Thank you again. We will be unpacking anti-Indigenous racism in the healthcare setting. And I can't believe how timely this discussion is happening on the FNHMA town halls. This dialogue has many impacts on COVID-19. COVID-19 has had many impacts on this dialogue, I should say. And I really appreciate everyone who is tuning into their radio stations. Thank you to our Indigenous media partners for making sure that people are getting accurate, reliable, and credible information regarding COVID-19 and the issues surrounding First Nations health. Also, a huge thank you to APTN. You can catch this if you're not listening live on ihtoday.ca or any of the Facebook platforms that you are viewing on. You can catch this on Saturdays on APTN, 5 o'clock Eastern, but make sure you check your local listings for the actual time in your territory. All right, so let's shake that off. I want you to know I am self-caring as well during this broadcast. I am just I am so grateful for the smudge bowl. We did light the smudge before we started filming, and I can still smell the sweetgrass and all of our medicines and tobacco that are in this smudge bowl. So we recognize Creator hearing that we need extra strength during this time. Again, FNHMA wants to share with you the phone numbers that you can reach out to if you're experiencing trauma, need some extra support, and thank you to the organizations who are answering those phones. So it is now time to call in our very first guest, one of my dearest friends, Dr. Shannon McDonald with the First Nations Health Authority. Dr. McDonald, Shan, come on into the crow's nest. And I'll just get to remind you to unmute.
Okay, my money jar is getting so full because of that. I'm really bad at it. Thank you. Thank you for your welcome, and thank you for your words and the smudge. It has been a challenging week. It has been a challenging year. And this morning I received the most amazing news in the COVID world that I've had for a long time. As of this morning, we have one new case COVID positive in British Columbia. One. And on Vancouver Island, where I am lucky enough to live on Sayut First Nation, there are no active cases among 45,000 First Nations people on the island. Vaccines work, and I need to acknowledge all of the people who have worked so hard through this 16 months now to support people in community, to make sure that people are getting tested, to organize vaccine clinics, and the energy and the time and the heart that's gone into that work right across the country really needs to be acknowledged. I can tell you about the stats in BC, but I think people are probably pretty interested in where things are across the country. So thank you to Christine for sharing with me some of those numbers. We have had administered over 500,000 vaccines into arms across the country as of June 1st. I know for British Columbia, we keep our data both for the on reserve and for those who live away from home. But when we combine those numbers, we have given out vaccine to over 100,000 people in the province, and we are well on our way to second dose. So as much as that excites me, and as much as I know that those vaccines work, they're not 100% all the time. And I am living, breathing proof of that. My husband and I both had our first dose of Pfizer on March 8th. He was diagnosed COVID positive on the 15th. I was diagnosed COVID positive on the 19th. We had reached that 2-week period after the vaccination, but both of us struggle a little bit with some chronic diseases, so it's not surprising that our immune systems were not 100%. Luckily, though, thank God for first dose of vaccine, we had a relatively mild case of COVID, and except for having to hang out with each other 24/7 for 2 weeks in the house, we came through it very, very well. And we are both receiving our second dose of vaccine this weekend. We know, because I want to acknowledge the people we have lost, the stories untold. Across Canada, First Nations in community have lost 343 individuals. That's a lot of people. That's an entire community. And in many cases, it was knowledge keepers, it was language holders, And so there has been a library of knowledge that has left us because of this infection. So from my own experience and from those stories, I want to strongly encourage people to continue the public health measures to keep everybody safe. Those that have been vaccinated, those that haven't been vaccinated, and those who can't be vaccinated for lots of different reasons. This week in BC, considering what has been discovered at Tecumseh, communities have been gathering to share their heartbreak. There was a sacred fire at the school for the last 4 nights, and thousands of people have traveled to Kamloops to honor the souls. It has been a very difficult choice as a public health doc, not to wag my finger at people and say, you shouldn't be gathering. That's not a good thing to do. But I know that people's mental health, people's spiritual health are also extremely important. So if you are going to gather, if you're going to share space, if you need to hug people to get through this, do it. But do it as carefully as you possibly can. Our teams have been handing out masks to people in those crowds, handing out hand sanitizer to people in those crowds, and doing what we can to support people through this journey. We're almost at the end of the race. This is the last few miles of the marathon. And we have an opportunity to make sure that people remain well, but are also supported in their time of loss and pain. So just encouraging people that if you haven't had your vaccine and you have concerns, to contact your health teams, have a conversation with your care provider. I strongly, strongly encourage you to get vaccinated. And we're really excited in that our 12 to 17-year-olds now are also able to get vaccine, and so that they can get back to real adolescent lives. They can go back to school, they can hang with their friends, they can go to the sports field, they can do all of those things. So I encourage you, and I've been encouraging young people that if their parents aren't vaccinated, to drag them along when they go to get their vaccine. So thank you again for always including me, helping me to celebrate the success of our battle against COVID-19, and to acknowledge the challenges of the day and ways to get through them as safely as possible. So thank you very much. Miigwech.
Dr. McDonald, thank you so much for not only joining FNHMA Town Hall, but for being the amazing woman Indigenous leader that you are. You have always been there for me. I count on you as my mentor, as someone I've always admired. And Shannon, we have too many stories to share on air. So a little laughter to lighten up that mood. And for non-Indigenous Canada, I know you're tuning in because this is the information that you can trust and count on. A number of non-Indigenous Canadians have been asking First Nation organizations, Indigenous organizations, especially given this past week and the tragedy that we are all feeling. Just a reminder, when you ask questions, people are mourning, people are grieving, we are dealing with trauma. And I encourage all of you to continue those interests in what's happening, education around the real history of Indigenous peoples with the Crown. And don't forget, the Truth and Reconciliation Calls to Action is an amazing place where you can find information about these very topics that we are unpacking today and moving forward. So thank you for your support, love of your neighbors, your friends, but let's do some digging before we ask others who may be re-triggered with trauma. With that, it is so amazing to have all these panelists who are such great friends. I'm going to call in one of our partners from Indigenous Services Canada, Jennifer Green. Jennifer Green is another person who has way too many stories about this crow. And she used to be my boss at one time too, just like Dr. McDonald. So Jennifer, come on into the crow's nest, a place you've been before. Welcome, Jennifer.
Thank you. Thanks for having me. Good afternoon, everyone. I'm a settler and first-generation Canadian. I'm pleased to be here. I'm thrilled to be here, actually, within the ancestral, traditional, and unceded territory of the Algonquin Nation. Thanks for starting off the town hall on anti-Indigenous racism, Marion. This has been really timely, and also it was great to hear some good news from Dr. McDonald on the COVID, the cases in BC going way down. That's wonderful, because it has been a very difficult and emotional week for many people, both with the discovery of the children's remains at the former residential school in Kamloops. It's also the second anniversary of the Missing and Murdered Indigenous Women and Girls National Inquiry final report tomorrow. And there's an ongoing coroner's inquiry examining the death of Joyce Echaquan in Quebec. I want to acknowledge that Indigenous leaders and physicians have long identified systemic and individual racism as an issue for a long time, and that it was Joyce Echaquan's death that brought a spotlight to this issue. Indigenous Services Canada is treating anti-Indigenous racism in healthcare as an urgent priority, and we've taken action and will continue to take action to address this issue. Canadians were rightfully outraged by the racism that Indigenous people face in Canada's health system, and that was highlighted by the racist treatment that Joyce Echaquan endured prior to her death last September. On October 16th, 2020, the department convened an urgent meeting bringing together Indigenous, provincial, and territorial governments and partners, health practitioners, and regulators to honor the life of Joyce Echaquan, but also to hear about the lived experiences of Indigenous patients and providers. Several hundred people attended that virtual meeting, in which the family of Joyce Echaquan, medical practitioners, and Indigenous leaders spoke of their own experiences of racism and racist treatment in accessing the healthcare system. And from medical practitioners, we heard the racism that they experienced while in medical school or as doctors currently working in hospitals. Indigenous Services Canada, along with Health Canada, Crown Indigenous Relations, and Northern Affairs, committed to hosting a national dialogue to bring organizations and governments back together within a few months to start discussions on how to eliminate anti-Indigenous racism in Canada's healthcare systems. That gathering, that national dialogue, was held on January 27th and 28th of this year, where federal, provincial, and territorial governments and Indigenous and health system partners met virtually to share both short and long-term concrete actions to eliminate anti-Indigenous racism in healthcare systems. The national dialogue was once again attended by several hundred people and was facilitated in a way that gave health organizations and health system partners a brief opportunity to highlight their planned and ongoing actions to address anti-Indigenous racism. A wide range of organizations contributed to this dialogue, including the FNHMA, Canadian Indigenous Nurses Association, Canadian Indigenous Physicians Association, the National Association of Friendship Centres, Accreditation Canada, Canadian Roots Exchange, the Royal College of Physicians and Surgeons, the National Aboriginal Council of Midwives, Two Spirits in Motion, the National Indigenous Women's Organizations, and many more. There was actually about 35 organizations that presented, and they were only given 5 minutes to speak due to the vast number who were presenting, as well as the time constraints of a virtual meeting. The themes that emerged through that discussion and through online chats were There was 5. So the need for cultural safety and humility training, and a need for better understanding of the history of Indigenous peoples. The need for federal, provincial, and territorial legislative and policy changes. The need for accountability mechanisms for people to feel safe to report incidents of racism and to know that something was going to be done. The need to gather and monitor data on the results of activities intended to eliminate anti-Indigenous racism and those intended to promote cultural safety so that we know that we're making a difference. The need to transform and expand healthcare systems. Immediately after the January meeting, the Ministers of Indigenous Services Canada, Crown Indigenous Relations, Health and Northern Affairs issued a statement on the work to eliminate racism against Indigenous people. The ministers acknowledged that Canada's history of colonialism has driven racist practices, behaviors, and policies against Indigenous peoples. That systemic racism is embedded in our country's healthcare systems, and that while progress is being made, there is still much to do. They noted it is only by listening and learning from the experiences of Indigenous patients, practitioners, and health professionals that real change will come. After this meeting, there was also a shared commitment that was signed by provinces and territories and the federal ministers to build on the current momentum to make real and lasting change, and that change needs to be rooted in a recognition of the importance of land, culture, language, and Indigenous-led health approaches. They noted the work ahead will build upon effective efforts already underway in jurisdictions to ensure that health systems are culturally inclusive, responsive, appropriate, and demonstrate cultural humility. Provinces and territories remain committed to working with local Indigenous communities, organizations, and leadership on this critical issue. There were a few announcements and commitments made by the Government of Canada at this national dialogue. So these were $2 million were committed to the Atikamekw Nation and Manawan First Nation for their continued advocacy of Joyce's Principle. Joyce's Principle aims to guarantee to all Indigenous peoples the right of equitable access to social and health services, as well as the right to enjoy the best possible physical, mental, emotional, and spiritual health. We also supported the National Collaborating Centre for Indigenous Health to create a one-stop shop for cultural safety and anti-racism tools and resources that will be available on the web very soon. This is just the beginning, and we remain committed to ensuring that Indigenous peoples have access to culturally safe and high-quality health services. On April 19th of this year, the 2021 federal budget proposed to provide $126.7 million over 3 years beginning this fiscal year to take action to foster health systems free from racism and discrimination where Indigenous peoples are respected and safe. This funding will support patient advocates, health system navigators, and cultural safety training for health professionals. We will be convening a third national dialogue in late June to continue pursuing collective actions related to increasing Indigenous representation in post-secondary health education, cultural safety and humility training, traditional approaches to health, and safe patient navigation. Stay tuned for more information on this and how your voices can be heard through roundtable dialogue. Thank you, Marion.
Jennifer, thank you so much. That was amazing. And you were nervous for nothing. Thank you so much for sharing that very wonderful information, Jennifer. I do want to remind everyone who's listening and watching, including you, Paula. I see you are tuned in. Thanks for watching us. I just want to remind you that if you have a question or a comment, it's unlikely, I'll be honest, that we're going to get to it today, but we will definitely make sure we get a response from either these panelists today or upcoming panelists for future shows. And on that note, it's National Indigenous History Month as well. So I want to see everybody making sure that they are continuing with the sewing, with the beading. Our regalia needs to be spectacular for when we hit the powwow trails again. And there is hope. We're starting to see it here in Ontario, a little bit of an easement of our restrictions, and usually that funnels west. So I am hopeful that if I don't see you on the powwow trail this year, we're definitely going to be there, and all of us are going to be there together because we're going to keep following those great health guidelines in keeping us protected. Now, a first timer to the show, we're welcoming into the Crow's Nest Andy Garrow from Indigenous Services Canada. And before you even say anything, Andy, it's delightful to see you outside of a farm boy on a Saturday afternoon. That was the last time I spotted you. And who couldn't miss the crazy curls? I hear I owe you a haircut. Come on in, Andy.
Thanks, Marion. Hi, everybody. I'm Andy Garrow, and I'm an Anishinaabe from Sagamuk and Duningahage from Akwesasne. I also want to acknowledge that I'm on unceded Algonquin territory in Ottawa, and also wanted to acknowledge and honor the 215 children who never made it home and whose spirits now are on their journey home, and to honor them all. In doing this work on anti-Indigenous racism, I also wanted to acknowledge that the approach that we're following is Indigenous-led. And this is working through a planning committee that includes Indigenous health professional organizations such as the Indigenous Physicians Association of Canada, the Canadian Indigenous Nurses Association, the National Aboriginal Council of Midwives, and our host today, the First Nations Health Managers Association. We also have representatives from the Assembly of First Nations, Inuit Tapiriit Kanatami, the Métis National Council, and the National Association of Friendship Centers. And leading into this June National Dialogue to ensure that we have a collaborative approach, we have representation from provincial and territorial governments, the Yukon and Northwest Territories, and health system partners, mainstream health system partners, such as the Canadian Association for the Schools of Nursing, and the next guest from Health Excellence Canada will speak more to their role as well. The work that we're doing on this really reflects the need for action. What we hear a lot from our partners is that the time for talking about racism, the time for questioning racism has passed. And that the dialogues that we're hosting need to acknowledge that racism exists, and it is now time for more action. And this approach is informed by previous reports, such as In Plain Sight, Joyce's Principle, the Truth and Reconciliation Commission final report, and the final report from the National Inquiry into Missing and Murdered Indigenous Women and Girls. There's ample evidence in those reports that demonstrate racism throughout all the systems and levels of healthcare, to know that we need to move forward with action in this work. And in acknowledging that it's in all levels and all systems, we know that those national dialogues, and Jennifer pointed to the amount of time that each speaker had at the January one. There needs to be more time for people to share best practices, to share their approaches to addressing racism. So at the urgent meeting on October 16th in 2020, the concept of initiating distinctions-based thematic and regional roundtable dialogues emerged. At these, participants have the opportunity to contribute to a series of courageous conversations on the importance of recognizing, preventing, and addressing the experiences of racism in accessing health services. Roundtables also offer a unique opportunity for diverse partners to come together for focused discussion and move forward on specific topics of relevance in order to further advance concrete short and long-term actions. These discussions are an opportunity to provide additional information and recommendations for the next national dialogue in June 2021. To date, we've had roundtables hosted by the Indigenous Physicians Association of Canada, who've hosted two on racism in medical education, Accreditation Canada, who are guided by a Council of Indigenous Indigenous knowledge keepers who are assisting in developing of their practices. The National Aboriginal Council of Midwives brought together a collective of Indigenous organizations and mainstream health organizations to talk about racism and education. And again, and Turtle Lodge hosted a webinar back in December that focused on the traditional approaches to health. And recently, the Atlantic Policy Congress hosted the first regional roundtable, which focused on the priorities of the communities out there. And next, you'll hear about another work done by Healthcare Excellence Canada, who partnered with First Nations Health Managers Association on a roundtable in March. Thank you, Marian.
Thank you so much, Andy. I really appreciate that. And I'll just get you to mute now, Andy, but don't go far because questions are on the way. And for those that do have questions, you can send them to fnhma@ihtoday.ca. Well, with that being said, and I don't know if you noticed, but thank you everybody for joining me in wearing orange for this very special edition of the FNHMA Town Hall. If you want to find out more about why we wear these orange shirts, please make sure to do a little Googling. The Truth and Reconciliation Commission calls to action talks a little bit about residential schools. You can take a look at Orange Shirt Day and a whole host of other resources that talk about the representation of why we wear orange. Now it's time. I have to say, I am so grateful. It's like having a TV following me, just watching us have chats amongst friends. How cool is this? Because everyone that comes into the Crow's Nest, it's just a good old friend. And with that, my friend, Nicole Robson from Healthcare Excellence Canada, formerly that was the CPSI organization and CFHI, now amalgamated into Healthcare Excellence Canada, and a partner of FNHMA. Come on in, my Indigenous sister, you, Nicole, come to the Crow's Nest.
Thanks so much, Marian, and thanks for having me here today. I'm honored and privileged to be joining you from traditional unceded, unsurrendered Algonquin territory here in Ottawa, where I'm incredibly grateful to live and raise my family and work. I come from mixed European and Cree Métis ancestry, with roots in the Red River settlement in Manitoba and southwestern Ontario and in New Brunswick, but was born in Ottawa and have spent much of my life here. I am the Director of Northern Indigenous Health at Healthcare Excellence Canada, but above all else, I'm the mother of two beautiful boys, Jack and Quinn. And as a mother, I want to take a moment to recognize the 215 children whose lives were taken at the Kamloops Residential School. My heart aches for those children, for their parents, their grandparents, their families, and their communities. I thought I'd hold it together a little bit better with that, but to turn it over to the topic that we're discussing today. As Marian mentioned, Healthcare Excellence Canada is an organization that was officially launched in March of this year, and is the amalgamation of the Canadian Foundation for Healthcare Improvement and Canadian Patient Safety Institute. We're an independent, not-for-profit charity funded by Health Canada with a focus on improving healthcare with and for everyone in Canada. We have been undergoing engagement across the country as we develop our strategic plan, and it's not finished yet, but I can share what will likely be the focus areas and the ways that we'll be doing the work that we're doing. So the focus areas are the key areas of healthcare that we aim to improve. Our care of older adults with health and social needs, care closer to home and community with safe transitions, and pandemic recovery and resilience, of course, top of mind for everybody these days. We also have ways of working which are really foundational to how we conduct our work, and these were actually established in our amalgamation letter of agreement and will continue to be considered at every point of the work that we do. The first is culturally safe and equitable care. The second is the commitment to be guided by the perspectives of First Nations, Inuit, and Métis. And the third is to be guided by the perspectives and lived experiences of patients, families, and caregivers. Within Healthcare Excellence Canada, we have a Northern Indigenous Health portfolio that has been a key portfolio of the previous organization, Canadian Foundation for Healthcare Improvement, for several years, and I had the honor of joining the team as the director in December. And we really have two streams of work, one that's internal facing and one that's external facing. So in having this focus on Northern Indigenous health, really know that we need to do the work internally to build up our capacity right across the organization to meaningfully engage with First Nations, Inuit, and Métis. And so that internal facing stream of work is really focused on capacity building, training, as well as looking at policies and processes and infrastructure to support that meaningful engagement across all portfolios. And externally, we have a few different buckets of work, but what we're here to talk about today is the work around racism. And so for us, that's really about recognizing racism as a significant quality and safety issue and addressing racism in healthcare systems. And so as we embark on this work over the next several years, but then this year in particular, we're looking to co-host a national distinctions-based series of roundtables that focus on identifying and addressing anti-Indigenous racism in healthcare systems. And then our hope is that the outcome of this engagement will be the co-creation of Healthcare Excellence Canada's response to addressing systemic racism and supporting cultural safety and humility in healthcare systems. As Andy mentioned, there were a series of requests from the federal government to host roundtables related to the larger meetings that were happening. And so we, the previous Canadian Foundation for Healthcare Improvement, received a request towards the end of last year to host a roundtable focused on patient safety and quality. And so we reached out to our very valued partner, First Nations Health Managers Association, to ask if they would be up for co-hosting with us. FNHMA has been a valued partner for many years, and one of the things that we have the privilege of doing together is to sponsor the First Nations Health Managers Association Leadership Award. When we connected, we talked about what should our key focus area be, and talked about the fact that there did seem to be quite a bit of momentum and quite a bit of conversation happening at the healthcare provider level, and that given our organizational mandates, we thought we had a role to play at the health leadership level and supporting health leadership. And so we wanted to support the creation of safe space for a really honest and meaningful discussion that brought together First Nations and non-Indigenous health system leaders. So we looked to the nominees and recipients of the FNHMA Leadership Award, as well as FNHMA board members of Healthcare Excellence Canada, extra fellows, and members of the Canadian Northern Remote Health Network. Extra is a very long-standing program from the previous Canadian Foundation for Healthcare Improvement, and it's a recognized team-based leadership development, quality, and patient safety improvement fellowship that's grounded in leading and managing change in the reality of today's healthcare and social services environment. The Canadian Northern Remote Health Network brings together decision makers, leaders, policymakers, and practitioners from 14 organizations across 6 provinces and 3 territories, with a focus on enhancing leadership and improvement capacity by sharing learnings, innovations, tools, and resources focused on healthcare improvement in northern remote areas of Canada. We worked with an advisory committee that had a selection of individuals from each of those groups that I just mentioned, and looked to them for guidance on the design of the roundtable in terms of format, the key questions, and who we should invite. We also had a fantastic First Nations facilitation team. If anyone's looking for a great facilitator, I'm happy to pass that information along because they were really excellent. And we knew that we wanted to focus the conversation on action. Again, as Andy had said, the time has passed for debating about whether racism is a problem And so we didn't want to have to start at that point with the conversation. So we actually developed a summary that we shared in advance so that participants entered the conversation from a shared understanding that yes, racism exists and it's a significant patient safety and quality issue. We only had 2 hours, and a key lesson is that that is not quite enough time. But given the small amount of time, we wanted to focus the discussion and we wanted to have most of the time in small breakout groups. So with the support of the facilitators and of that advisory committee, we landed on 2 key questions to guide the discussion. The first was, how can healthcare leaders address the systemic racism experienced by First Nations patients and families? And the second was, how can Healthcare Excellence Canada and First Nations Health Managers Association support the action required to address racism experienced by First Nations patients and families in healthcare systems? We have a draft report that's not quite ready to share, but what I can share are the key recommendations that came from the conversation. So in terms of the first questions in terms of what organizations and healthcare leaders can do, number 1, make sure there are First Nations voices at all levels of the organization, staff, procurement, board, senior leadership, every level. Number 2, invest in training for every single member of the organization, and that training should include Indigenous history as well as anti-Indigenous racism. The third is an organizational Indigenous health strategy, but maybe even more importantly, to make sure that the elements of that strategy are adequately and sustainably resourced. The fourth is to develop a mechanism for accountability, including evaluation metrics. The fifth is that zero tolerance racism policies should be developed and implemented, that inclusive spaces need to be created and supported within healthcare environments, that there need to be mechanisms for reporting racism developed and supported, and then that First Nations organizations need to be respected and supported in their own mandates, and that First Nations people, staff, history, and communities need to be celebrated. So you see a lot of similarities in those recommendations from those that Jennifer shared earlier. And then for the question of what Healthcare Excellence Canada and First Nations Health Managers Association can do, or similar organizations, the first recommendation is to support and organize regionalized discussions that specifically talk about racism experienced by First Nations. And you heard Andy mention that some of those conversations are starting to happen at a regional level. The second is to develop a kind of a how to advance and implement an anti-racism framework guide for organizations to consider as they start this work. The third is to work with partners to develop a robust mechanism to identify, measure, and evaluate racism in healthcare, and to advocate for inclusion of this in accreditation processes. And then finally, to support efforts towards mandatory ongoing anti-Indigenous racism training and strategies within healthcare organizations. Within the organization, we're really reaching out to have as many conversations as we can as we scope this work out. We've had other conversations outside of this roundtable, obviously, and just wanted to mention some of the other thinking that we're doing. One is really how we as Healthcare Excellence Canada can support health leaders to create culturally safe healthcare environments. So perhaps that's supporting the development of anti-racism or cultural safety strategies with guidance on what the key components of that need to be. So like having a self-assessment tool, mandatory training, development of relationships with First Nations, Inuit, and Métis in order to inform the strategy and direct the strategy, adaptation of physical spaces, reporting and measurement, etc. As I mentioned a few times, this was really just a first conversation for us, and we are looking to have similar conversations that are focused on the experiences of Métis and Inuit in healthcare systems. And also, as I mentioned, we're looking at the opportunity for regional roundtables. So to bring together First Nations, Inuit, and Métis health leaders with non-Indigenous health leaders at that provincial territorial level to talk about what really needs to happen within that specific health system. And then what can we as Healthcare Excellence Canada do to support the action that's needed at the system level? This engagement will really inform our response and ensure that we're meeting the needs of First Nations, Inuit, and Métis, that we're focused on action, and that our response is appropriate given our role as a national mainstream organization. Thanks, Marion.
Thank you so much, Nicole. I have to say, it is always so wonderful to work with our partners, Healthcare Excellence Canada, and thank you for allowing us to poach one of your staff. This is what the foundation of partnerships is all about, is making sure that we can lift each other up, support one another. And I'm going to do a big shout out to our communications director, Kim Mumford, who came to FNHMA on interchange from Healthcare Excellence Canada. She's come to this side of the table and we love it. So thank you again. Now, I know that we've just unpacked a lot of information, and there are those who are still fresh in grief, in sorrow, in anger, in frustration. And on that, I do want to share some resources once again with you. And I just realized I covered up my microphone. But for the studio, if you wouldn't mind just sharing with us one more time the phone numbers that we have cultivated to share with our audiences. And thank you. We would like to acknowledge again the Indian Residential School crisis line, the Hope for Wellness line, and of course the Indian Residential School Society, all who are working 24 hours a day, 7 days a week to help people through what is an unthinkable tragedy. And I'd be remiss if I did not say that I think this is probably the beginning of a lot more souls being found as the calls for the government to support looking at all of the other residential school properties continues. As an individual who grew up right next door to the last residential school in Canada that closed in 1996, this is not hundreds of years ago. This was my generation. I stand with you in holding you up, in hugging you, and sending my love, our collective prayers to everyone who needs some guidance. Thank you for that. So I do want to get back, while we have a couple of moments, to come back to the topic of COVID-19. Dr. McDonald, Shan, I feel weird when I call you Dr. McDonald. Shan,
Hi.
come back in. I hear there's another variant. Should we be worried about more variants coming? What are some of your thoughts on that as a top doc in BC?
Viruses are fickle beasts. And I always tell people they are like teenage girls who need to change their clothes several times during a day to figure out what makes them most popular. And that's basically what viruses are doing. They evolve to try to be more infectious because they don't have the ability as a virus particle to replicate themselves. They need a human host to do that. So their job is to be as infectious as possible and to make people sick enough to make them cough so that they will spew virus particles onto other people. That's their job. So just like every year we get a different flu vaccine based on what's happened in the world and the changes in the influenza virus, we fully expected and anticipated that COVID would do the same thing. And the first ones that we identified, the one from the UK, the one from South Africa, later one from Brazil, have all been studied significantly in the context of the vaccine delivery that we've had. And for the most part, with slightly less effectiveness, they do okay against those three. We're a little more worried about the latest that has come from India. It does seem to have evolved an ability to bypass the vaccine in some cases. More study is being done. What we do know is that the vaccines that we have support the majority of our ability to resist infection, or more importantly, to resist becoming very, very ill and requiring hospitalization or tragically death. So the job of the vaccine isn't necessarily to keep everybody completely away from COVID, but to prevent the serious impacts of COVID. Most of us will be fairly lucky, myself excluded, of course, and not have to suffer the consequences of a COVID infection. Over time, just about to get my second dose of vaccine, over time it may be that we have boosters or annual COVID added to our fall respiratory illness immunizations. COVID isn't going away. It will never, ever disappear. It's established itself in the human population, and it will be here. So our job is to do our best, not only through immunization, but through our behavior, to keep from getting sick by it. Interestingly, in British Columbia, at least, there were literally one handful of influenza cases this year. Normally, there's hundreds, thousands, including a significant number of deaths among vulnerable people. But because we've been behaving in a way that decreases our interactions with people, we're not coughing and sneezing on people, we're washing our hands more frequently, we're cleaning surfaces more frequently, we've managed to prevent serious influenza cases. So we know we can do this. So are we worried? Well, we have to watch, we have to be cautious, and the scientists will continue to do their work. But our work is really those basic public health principles. And we can continue to that and do that and protect ourselves not only from COVID, but from other infectious diseases as well.
Thank you so much, Shannon. I really appreciate your thoughts and input into that question. So I'm going to also shout out to Jordan, who is watching us as well. And I believe we had another shout out from Julie. Jordan and Julie, thanks for watching and getting your safe, reliable information here on the FNHMA Town Hall. So I'm going to actually, Jennifer, I know you don't want to come back into the crow's nest, but come back in like a minute or less. What are some of the other emerging topics that you're seeing that are very common to the National Indigenous gatherings on the roundtables? And maybe this is a question for Andy, but obviously there are themes coming out of all these discussions. So Jennifer or Andy?
Well, I think that, thanks, Marion. I think that the themes that we'll be discussing at the next national dialogue, and they resonate with what Nicole had said from the town hall that her organization and yours partnered on. Those seem to be the ones that are coming up more and more often. So the need to increase Indigenous representation in the healthcare system, the need for safe patient navigators and safe patient navigation, the need for understanding and recognizing traditional approaches to health, and I always miss the fourth one. Andy might need to save me on this one.
The increased access to Yep.
Cultural safety and humility training. Yeah, so those are really the themes. They've been coming since January. They were in place long before we had programs that looked at some of those, and we've had many reports, as Andy had mentioned, in the past that had identified these as issues and needs. So they're coming back, and they continue to be at the top of the agenda.
Thank you so much, Jennifer. And with that, I tell you, this hour, it flies by just like that. And I do want to say, Shannon, thank you again. Nicole, you keep rocking it at Healthcare Excellence Canada. Jennifer, well, we'll just keep partnering and discussing all the ways we can continue that partnership. And Andy, welcome to the FNHMA family. Once you're in, there's no getting out. So I say to all of our Indigenous partners who make this happen, a big thank you, especially to Mi'kmaq Maliseet Native News, the Wolf 95.7, Nation News in Montreal, FNHMA, Element FM, Anishinaabeg Nation, Wawate News in the Sioux, Element FM in Toronto and Ottawa, NCIFM. Thank you. Can't wait to talk to you tomorrow morning on the air. And APTN, of course, MBC, Eagle Feather News in Saskatoon. Yay, Saskatchewan, Alberta Native News, CJWE in Calgary, CFWE in Edmonton, CKLB in Yellowknife, Co-op Radio in Vancouver, the First Nations Drum, CFNR in Terrence, and of course, our newest partner, Hashlasa newspaper in Port Albany, BC. I apologize that I enunciated that wrong. So until next episode, next Wednesday, please stay safe, stay healthy, and look after one another during this horrible time. Hi.